Good morning to our colleagues. I'm going to present on today's topic is nerve fibers and classifications lah. So basically last week I was talking about the pain, the pathophysiologies lah. So basically there's the four things that I mentioned, which was the transduction, transmission, modulation, and perception. So one of the ways impulse being passed, the pain receptors being activated and passed to the CNS, and we have the reaction. So all these involving this nerve fibers lah. So nerve fiber is the important component lah in passing the impulses. So besides these nerve fibers, okay, we need to know about these neurons. So the bundle of the nerve cells is called passes the impulses to brain. So there's a neuron lah. So neurons, there's three types of neurons. Okay, the first one is the unipolar, bipolar, and the multipolar. So the multipolar comprises about 99%. Actually, most of the function is through the multipolar neuron. This bipolar, usually during the kid time, when you are kids, during we are in child, then this bipolar works lah. So mostly it's multipolar lah. So it's the classification of neurons by function and the structure lah. So what the neurons will do, and okay, so this is the sensory receptors with the dendrites, and this the axon. Okay, this is the central and the peripheral nervous system now. So from the peripheral nervous system, and there's a stimuli, so the sensory receptor will be activated. So it pass the impulse to dendrites. From dendrites go to the axon and then to the cell body. So then after that, the cell body in the central nervous system, there will be interneurons lah. So interneurons is among the axon, and another axon will be passing the impulse. So this is called as the modulation lah. So then after that, from the central nervous system to peripheral nervous system, so this one it will be the perception, okay, and also descending pathways lah. So this is the motor efferent neuron with the axon and axon terminal here. Okay, this is how it works actually. So basically how it works, there is actually an action potential. We call it as action potential lah. So the impulse being passed from one axon to another axon. So I'll tell about this axon first. I mean the action potential lah. So there is actually is a graph, actually a graph that the horizontal is the say comprises of the time, and the vertical comprises of the voltage lah. So when we have a stimulus, pain stimulus, so there will be a deeper that the body will react to the stimulus, right? So and then there will be a depolarization. So when there's a depolarization, there will be the voltage gated theory. There's a voltage gated. The sodium will going in, so which makes which will make the voltage to increase to positive 40 lah. So then it will have this action potential. So when the repolarization occurs, when this potassium ion is out, so then you will see there will be a lot of negative ions will be going out. So that means it will go towards the negative side. So this is a negative 70. Then hyperpolarization. So too much of potassium ion is going out. So it means there will be a hyperpolarization. And when there is sodium and potassium in a balanced state, there will be a resting state lah. So basically it's about the how the axon, how the impulse being passed through this action potential. So this is just a rough picture actually, okay. So then after that I'll be talking about this structures of nerve actually. So when we talk about this nerve fibers, we need to talk about this nerve actually. So the nerve itself has connective tissue layers, the epineurium and the perineurium and the endoneurium. So the epineurium is the one covering the peripheral nerve, and the perineurium is around the one vesicle, the endoneurium lah. So this endoneurium, bundles of axon is being covered with this vesicle lah. So this is all the axons, and this is the one bundle of it. We call it as vesicle. So this is all vesicle, vesicle, vesicle. So around is the red and blue color is the blood vessels lah. So around this, all this is connective tissue layers lah. So actually this is the Schwann cells we call, and this is the myelinated axon. So there is I will talk about the myelinated and the unmyelinated axon later lah. So usually for peripheral nervous system, usually Schwann cell will be the cells actually involved in lah. So if central nervous system, we can it's called as oligodendrocytes. So yeah, so this is the myelinated axons. The myelin is actually comprising of all the lipids actually covering the axon. So okay, this is the classification actually based on the histology that I mentioned just now. So the myelinated and the unmyelinated, and the functional, afferent and efferent, and the conducting velocity in relation to the diameter, type A, type B, and type C. So okay, so I'll talk about the myelinated histology part lah. So the myelinated and the unmyelinated. So like I mentioned just now, there's the myelinated is roughly this is the process of how the myelin is being formed lah, and this is the non-myelinated. So what is the difference actually? So this is the Schwann cells lah, okay. So this is the Schwann cell, and this is the axon surrounding it. So the Schwann cells, the Schwann cells has cytoplasm, nucleus, and also membrane. So what they do is that they will try to capture this thing. They will try to they will try to capture this thing, and when they capture it, and they groove it inside lah. So they call it as a mexoson. Okay, so when they they call it inside as a mexoson lah. So then after that roll until it becomes a myelin sheet formed lah. So then this is called as urillema. Okay, and then this thing is called as myelin sheet lah. So many times of forming a sheet. Okay, then this is called as external mexoson lah. So this is about the myelin formation actually. So the non-myelinated is usually the axons will be actually the axons will be outside, like the Schwann cells will be inside. So if you see, this is the difference lah. So this one will be inside, this one will be outside the axons lah. Okay. Then after that, okay, what is the difference between this myelinated versus the unmyelinated? So if you see the myelin, this is unmyelinated, okay, without any myelin sheet around it. Okay, if you see this is with the myelin sheets. Okay, so the impulse being passed, if you see in the unmyelinated, the conduction is continuous. Okay, and in the myelinated, we call it as a saltatory conduction lah. So they have these nodes of Ranvier here. So these nodes of Ranvier is the one will pass from this side, so from this impulse to this another side. So this is the one I mentioned just now. The action potential will react from this part to this part, this part to this part, this part to this part. So this is called as saltatory lah. If continuous, will be there is no nodes of Ranvier, so they will continuously without any they won't stop actually, they will do continuous only. So this makes the thing to be very slow propagation of impulse lah. If you see this, it will be very fast lah, because there's gaps actually. So this is called as continuous. That's this for the unmyelinated, you use the continuous, and the myelinated saltatory conduction lah. So this is the one I mentioned, the action potential, okay, the graph actually. And then after that, this the classification we use now, the latest one lah. So there's a fiber type A, B, and C. So A alpha, A beta, A gamma, and A delta lah. So initially they came up with this A alpha and also A gamma. I think the first few researcher, and then after that they came up with the beta. So then after that they found out there's a B and C. They found out A and C first. Then after that they found out the B. So this is based on the diameter, okay, diameter, the conduction velocity, and the function lah. So if you see the A alpha is the diameter is 12 to 20, the conduction will be the fastest lah, 70 to 120. So the function mostly on the proprioception to the somatic motor, and the A beta is diameter is 5 to 12, and the conduction velocity about 30 to 70 lah. So the function mainly on touch and the pressure. So if you see the gamma, you see the V 3 diameter will be 3 to 6, the conduction velocity will be 15 to 30 lah. So the function mainly on motor to muscle spindles, with the delta diameter will be 2 to 5 with conduction velocity 12 to 30 lah. So function will be mainly on pain, cold, and touch. So if you see the fiber type B, the diameter will be, you see the diameter will be reducing in if you see from A, B to C. So, and then the conduction velocity 3 to 15, and the function on preganglionic autonomic. So the dorsal root for the C type, there will be dorsal root and sympathetic. So the diameter will be 0.4 to 1.2, and the sympathetic 0.3 to 1.3. From the conduction velocity 0.5 to 2, and the sympathetic 0.7 to 2.3. So mainly on the dorsal root, the function is on pain and temperature, and the sympathetic post-ganglionic sympathetic lah. So then after that, there's a numerical kind of classification. So they came up with 1A, 1B, 2, 3, 4. So basically this also like Lloyd and Hunt classification of nerve fibers lah. So the function of group 1A and 1B, so is mainly on the primary muscle spindle efferents and the efferents from the tendon organs lah. The group 2 is the cutaneous mechanoreceptors, and the group 3 is the deep pressure sensors in muscles, and the group 4 is the unmyelinated one lah. So if you see the diameters is going down, this is the highest one, and this is the lowest one lah. So conduction also the same thing, okay. Then this is the relative sensitivity of the A, B, and C fibers on the selected factors inducing the blockade of transmission of action potential. So if you see the fiber type A, what they are more sensitive. So if you see the plus means it's going more towards like a moderate sensitive like that. So if you see this one, pressure is plus means the sensitive more sensitive lah than this one, and this one local anesthesia is less sensitive lah. So if you see this one, B fiber type B is more sensitive to hypoxia, and the pressure is moderate, and this one also moderate lah. So if you the C type will be less sensitive to the hypoxia and pressure, and more sensitive to the local anesthesia. So yeah, that's all about the nerve fiber and the classification. Any question can ask.